At night, his body started to shut down and the doctors told us to basically prepare for the worst. On October 21st of last year, I took my then 16-year-old to have his wisdom teeth removed, as 2 of them were impacted and causing him a lot of pain. It seemed innocent enough. Almost all of us have had to have our wisdom teeth removed. 3 weeks later, he was in the ER coughing up blood, and we were told that he was septic. At this point in time, it was believed that he just had a really severe case of pneumonia from the dental surgery, as he was my child that hardly ever got sick. They put him on a bunch of antibiotics, and not even 48 hours after he was admitted to the hospital, they had to intubate him. His CO2 levels were climbing and he couldn't breathe safely on his own. He was on the ventilator for 2 days, which in that time they switched up his antibiotics, gave him some steroids. Again, we were told that this was just a really bad case of pneumonia, but when the doctor came to talk to us after they intubated him, they said that when they were doing the bronch, like there were like layers of his lungs just coming off. The doctor said that his lungs were filling up with blood. Said he never saw anything like it before, but it just must be a resistant bug. So after 2 days, they woke him up off the ventilator and he was supposed to be getting better, but he wasn't. He was actually getting worse to where he could hardly move. I think this was the scariest part of it because deep down I knew something else was going on and he just was getting sicker and sicker. My biggest fear was we weren't going to find out what was wrong until they did his autopsy. A few days after of just him not getting better, a different pulmonologist came on his team. He immediately was like, something's wrong. He had one other patient in his 40-year career that had this disease. So we started running some tests and come to find out that my son has a rare autoimmune disease. It's 1 in a million that a child would get it. It's called GPA vasculitis, formerly known as Wegener's. So after they found out that he has this rare autoimmune disease, they talked to a pediatric rheumatologist that basically told them what the regimen of treatment was. A lot of steroids and Rituxan, which is an immunotherapy drug. It worked and he started getting better within hours. Altogether, he spent about 2 weeks in the ICU and 1 week on the floor. He got to go home right before his 17th birthday. In the hospital, we were told we wouldn't know the damage to his lungs for a few months because basically how the lung tissue works is as it heals, it creates scar tissue, which makes it hard for oxygen to move throughout like it's supposed to. But we were also told that he was young and healthy before, so he should just bounce back. Most likely the damage would be minimal.
But after 2 weeks, things started to take a turn for the worst.
So about 2 weeks after he was discharged from the hospital, we realized through outpatient, they realized that he was leaking a lot of blood protein into his urine, which signals some kidney issues. So that's when they referred us to a nephrologist for a kidney biopsy. So he got sick in November. The first week of January, we went in for an outpatient kidney biopsy. This is when we realized that he had high blood pressure. We tried to get it controlled at home with meds, but it was a no-go. So they were like, we need to admit you inpatient for like 5 days. They got the biopsy back. It did show some vasculitis involvement, but it's not as much as they thought. So they're like, just hang tight. We're going to wait for the Rituxan to work. The issue with this is right before his biopsy is when I realized that he was starting to get very, very short of breath just coming up the stairs. 3 weeks prior, they had done a PFT and his lung function was at 58%. Not great, but not horrible for everything he'd been there. When they tested his lung function during this time, it had dropped to 29%. I was ignorant. I had no idea what this meant. I figured it was fine because he was on room air. A week after discharge, he woke up struggling to breathe. His oxygen was at 57%. So of course we called 911. And for the next 2 weeks, we did this yo-yo of going to the hospital because his oxygen was low because we didn't have oxygen at home. They finally gave him oxygen along with a shaker vest to help shake things up because they believed he had mucus plugging. This is also when they realized that he had bronchiectasis, which is scarring of the airways. But at this point in time, like the scans didn't look super bad. About a week after the hospital stay that got us oxygen at home, his pulmonologist called us saying that they wanted him to come in for a lung biopsy. This wasn't a needle one. They wanted to get actual like samples of his lung tissue. I was still so ignorant. They just said that they don't know what's going on. He should get better. This isn't following the normal course of GPA. Before we could get the lung biopsy scheduled, he started to need oxygen round the clock. So they admitted him to the hospital for the lung biopsy. They tested his lung function and it was 14% after 5 days of aggressive airway clearance. It was believed that it was most likely below 10% when he came in. I still didn't understand it. I don't think they did either. They were just trying to figure things out. They thought maybe it's another autoimmune or maybe it's this or that. They just didn't know, and they're like, a biopsy will give us the answers. They did the lung biopsy, but because of how sick his lungs were, they had to put him back on a ventilator. That night, his body started to shut down and the doctors told us to basically prepare for the worst. His kidneys were just crashing, and as quickly as things went down, he recovered. They were able to remove him off the ventilator within 24 hours, which was amazing. We got the biopsy results back and basically it gave us no answers besides inflammation and scarring. This is when we were told that our son needed a double lung transplant to continue living. We were told he needed a double lung transplant the conditions and the reason was really unclear to us. After asking for them to explain it every day that he was inpatient, it became a little bit more clear. The first flare-up in November damaged his lungs beyond repair. It caused bronchiectasis, which is again scarring of the airways, and really big nodules on his lungs. He had obstructive lung disease where he could breathe in, but he couldn't breathe out. For the following months, his lung function never got above 15%. After a month's stay, they sent us home, but within, I want to say, a week to 2 weeks after that discharge, we were back in the hospital and he had to be put on a BiPAP ventilator 24/7. As horrible as that sounds, it saved him from the ICU and it allowed him to be at home and enjoy as much of his life as he could in the best way he could. From the time we were told he needed a lung transplant, it took about 2.5 months before he was actually listed because there's a whole process. And during that time, he was in and out of the hospital. It was very, very scary. We knew with each hospital stay, it was shortening the time that he had with his current lungs. On May 16th of 2023, he was listed, and within 36 hours, they found him a donor. On May 18th, he had his double lung transplant. His lungs were a lot more damaged than the scans led on. Because of that, he bled a lot, and he had a few complications, but the team said they were all normal, and within a month he was discharged to go home on no oxygen. He is now 4 months post-op and doing fairly well. His lung function is 68%. I will never forget how scary this time was, but I will always be thankful to the stranger that saved him. So yeah, be an organ donor.
We are so relieved to hear that Stephanie's son is finally on the road to recovery, as is already feeling so much better. And it all wouldn't have been possible if it wasn't for the absolutely incredible person who agreed to be an organ donor and literally save Stephanie's son's life. No doubt Stephanie and her entire family will forever be in debt to that person and their family for the literal gift of life that they gave to them. And the comments on Stephanie's story have been truly incredible, with one person saying, "Oh, how terrible. I'm so sorry you all had to go through that. I'm so happy his transplant was successful." Another said, "Love this. As a prior transplant nurse, I love these stories." And a final one said, "Yay for your boy. Hoping he has a fabulous life and drives you crazy like a kid should." As always, thanks for watching Happiest. If you like the story and want to hear more, be sure to follow our page and don't forget to send in any videos of your own that you would like to share.